now to share her expertise, Dr. Jehan El-Bayoumi. She's a professor of medicine at George Washington University, the founding director of the Rodham Institute, and full disclosure, she's also my primary care physician, and a very good one, right here in Washington, D.C. Dr. El-Bayoumi, it's good to see you. I just want to show our viewers we are living in one of the experiments that is most complicated. And people are seeing this all around the country and all around the world, that parts of your state might be doing good, parts of your country might be doing well, other parts not so much. I just want to put up first 14-day trend of new reported cases in the District of Columbia. You see it is flat in the District of Columbia, even going down. That is improving news, but the mayor says she still wants to wait until at least the first week of June to watch that go down. Then you look at the Maryland 14-day trend, neighboring state. It is down a little bit. It's a little bump in the last couple of days, but the overall trend line is down. And then the state of Virginia, which is more troublesome, you see it's about 1,000 cases there, but it's flat, and the governor says it is time to reopen. I want to zoom in, though, and get your expertise here. Look at Prince George's and Montgomery County, the two biggest suburban counties in Maryland, just across the border. They're still going up. And then look at Fairfax County and Prince William County, two suburban counties just outside of D.C. in Virginia, still going up. When you are at your hospital, how much are you dealing with D.C. and how much are you dealing with the complexities of the neighborhood, Maryland and Virginia as well?
Well, first of all, good morning, John. It's nice to see you outside of the clinic. I'm glad you're doing well. I had been working, actually, I just completed 8 days in the hospital, and now I'm working in the clinic. Our numbers have upticked just slightly at the George Washington University Medical Center, but I think that sometimes with all the statistics, we kind of lose track of the individual human beings. And the numbers are high. Yes, they're not as catastrophic as New York City, which was really the first onslaught. And yes, we're learning from them. But if you are that individual or that family member, that's the one is more important than all the numbers that are theoretical. What we are challenged by, especially here in DC, is that we are surrounded, and if we don't work together in terms of the reopening, what is affected maybe 10 miles down the street from us or in our neighbor, Virginia or Maryland, is going to impact us. And I think the other notion that sometimes gets lost in sort of the discussions or the narrative is that we have to look at vulnerable populations. And now, who are those vulnerable populations? We tend to think of the elderly, but if you are poor, if you are Black, if you are of color, if you name any other disenfranchised group, you're actually vulnerable because your social determinants of health, lack of food, the education, the economic environment which you are in, as a baseline, puts you at higher risk. So if we are truly one community, one people, we are, different religions where I think all of the religions have the same mantra of taking care of each other, then let's behave that way.
Well, let's look at some of those numbers as you mentioned it. These are the DC coronavirus cases by race. There's 6,700 total cases. 48% of them are Black or African American, 16% of them white. The population in the district is about 45% African American, 42% white. So you see a higher number of cases disproportionate there. And then you look at the deaths, 358 total deaths as we came to air. 77% of them are among Blacks, African Americans, only 11% of them among white. This is the disparity you're talking about, and it's there are legacy issues like access to food, access to better health care, and then there are the immediate issues of a lot of these workers here in the District of Columbia and the surrounding suburbs are essential workers who are still going to work in the middle of all this. So when you talk about lifting a stay-at-home order, that never mattered to them in the first place.
That's exactly correct. And these disparities COVID is just the latest example. I mean, we are in DC. It's a 10-mile city, the span. If you live in Georgetown, you could expect to live 94 years on average. If you live in Anacostia, that's 66 years. That's before COVID. That's just before COVID. We forget that some of those essential workers who are serving everybody and are also part of the healthcare system that actually make taking care of patients, they're essential, right? The people that serve the food, that do the transportation, that clean the operating rooms, they are now, instead of having to take 3 buses over, sometimes they have to take 4 buses over to reach their places of work. We know that African Americans tend to be in more outwardly facing jobs that interact with the public more. That is one of a myriad of reasons. So COVID is just the last sort of underlining of the health disparities that have existed.
Well, it's going to be fascinating to watch, especially in this area. Again, it's a 50-state experiment. It's a global experiment, but the complexities of this neighborhood, if you will, fascinating. Keep in touch. Doctor, it's good to see you. I'll see you soon
Great
in
to
another
see you.
capacity, I hope. All right, let's keep in
No,
touch. Up next.
no, not soon. Let's keep that. No, not anytime soon. All right, take care. Tom. Good to
Fingers
see you.
crossed, Doctor. Thanks so much. Up